Dear friends, I welcome you all to this wonderful auricular therapy classes. In the previous class, we have seen about lifestyle and the other things, the basic things which we need to advise the patients on. So, in this class today, we will start seeing about the subject which is about auricular therapy. In this class, we will know a few things about the history of this auricular therapy and how this auricular therapy came into use. Why we need to know all these things is because before we start a treatment with the patient, we need to make sure that the patient is very much confident about this therapy which they are going to take. It's not just the patient coming and sitting, just give me some therapy, let's see what happens, whether your therapy can cure me or not. The patient should not be there on a clinic without any belief on this treatment. They have to be 100% confident about the treatment. So, if you want to make your patient confident about this therapy, first we have to be very much confident. So we need to know what has happened with this auricular therapy for the past many years and how this auricular therapy came into place, how they were be able to give relief, how this therapy works. We need to know everything so that you will have a complete confidence about this therapy, and then you will give that confidence to the patient so that they will get a cure, very quick cure with the help of this therapy. And if the patient does not have the belief on the treatment, there is no point in giving them treatment. The chances of they getting cured is very less. So make sure that the patient has good belief on the therapy so that they will be able to get a good cure. So we'll start up this classes. We'll go the introduction of this auricular therapy. So this auricular therapy is an alternative therapy which is based on an idea of microsystem. What is this microsystem? This microsystem, the auricle, the outer portion of the ear is called as auricle. We are giving therapy on this organ, this part of the organ. That's why we call it this as auricular therapy. This ear, the auricle, is considered as a microsystem. On this small ear, we are going to give treatment for the entire body. It acts as a small remote control for the entire body. Or it is when we see the other systems like Sujok or seed therapy like that, they give treatment on your hands itself. The hands is connected to the entire part of the body. Likewise, in this auricular therapy, this ear is connected to the entire body. Wherever you want to give treatment, even it is on the head till the toe, wherever you want to give treatment, you can give treatment on this ear, on this part of the ear itself, so that it will be working. That is called as the microsystem. This microsystem works on this macro system. On the body, for the entire body, if you want to give treatment, you can give that treatment on the ear itself. That is called as a microsystem. This ear is called as the microsystem for this body. So this ear is connected to the larger portion, which is next to the brain. It is connected to the brain because brain is the only organ which is connected to the entire body. All the information are given through brain, and all the information are reversed. You get the information back from the organs to the brain. So brain is the one which is connected to all the organs. So which is the ear is as close, very close to the ear. The the results are very quick. When you give some treatment in one part of the ear, it immediately gets reflected on the part of that particular part of that body. On the outer portion of the ear, auricular therapy is used to treat physical, mental, and emotional problems. On this outer portion of the ear itself, the entire problems, not only physical problem, not only mental problem, but also emotional problems are being treated on this outer part of the ear itself. So that is the basic of auricular therapy. But with regards to this history of auricular therapy, this this auricular therapy has been there for more than 5,000 years as a part of the Chinese body acupuncture, the classical body acupuncture. This auricular therapy is the part of that body acupuncture. But in 1957, a French neurologist, Doctor Paul Neuger, introduced a more standard and systematic approach. He took this auricular therapy and he took this very serious. Where before that, this therapy was not being followed completely. But after Dr. Paul Neuger took this and he invented lot of things. He had this inverted fetus structure on the ear. He had an entire reflection of the fetus sitting on the ear, which we used to treat more than 100 diseases in one on this year itself. He has found that there are 100 points, 100 uh, small micro points on this year where he can treat any kind of diseases, any number of diseases. He carried this information to the entire international standard. So internationally, he took this information like Russia, Japan, and Chinese were very much interested in this auricular acupuncture, and he carried a lot of research on this therapy for more than 40 years. For more than 40 years, he was working on this auricular therapy. Even though he's a neurologist, he was very interested in auricular therapy and he was able to give relief for any kind of diseases. There are people used to come and ask for this auricular therapy. What kind of treatment you can give? What is the best disease this auricular therapy can solve? For this, we used to tell the patients that all these therapies are holistic. We don't deal with any particular diseases. We deal with the entire body. We don't deal with one particular disease. They think that, like, they compare us with allopathy and ask that this is ENT or ortho or eye surgeon or a neurologist or whatever different parts of uh, the body are there. So we tell them we treat the patient holistically. For all the disease, we have a solution. So that is there in auricular therapy. This work is so well regarded that his work, Paul Neuger's work, is well regarded that Chinese refer him as a father of modern auricular therapy. He was been, uh, he has been given the great name as father of modern auricular therapy. So that is the history behind this auricular therapy. And after that, what happens is auricular therapy, as I told, it was been getting famous in entire world, throughout the entire world. And not only it is getting famous just because of him, it was giving a quick and very fast result without any side effects. And auricular therapy is one of the fastest growing therapy and is used almost all over the world. The entire world knows about this auricular therapy. And also in 1990s, the World Health Organization, the Director General of the World Health Organization, at an international conference, uh, said that auricular therapy is probably the most developed and best documented scientifically of all the microsystem of acupuncture and is most practical and widely used. And before that, auricular therapy was there, but no one has followed that. After Dr. Paul Neuger took initiative, auricular therapy has become a different system itself, and there are many clinics all around the world as only for auricular therapy. Auricular therapy center clinic are there, or in mostly US, UK, you have only a different place for auricular therapy itself. So, and also the thing is, he has said, the Director General has said, and it has been best documented scientifically. A lot of things has been proven scientifically. And whenever we take a case, it might be you might be practicing acupuncture or auricular therapy, sujok or whatever, document that case, because we know that our therapy cures heart diseases, kidney issues, and lot of things that allopathy cannot cure. But the thing we miss is we do not document our cases. When we document our cases, in future you can give that it to our government, so to have an evidence that this therapy cures all these things. It is a good evidence, so that in future government will recognize these kind of therapy and will give permission for us to practice it. So we have to document everything, whatever case we are taking. We have to please make sure that we document every case. It might not be useful today, but in future it would be very useful that you document a particular case. Whatever case you get, a simple case or a major case, you document that case. So that is why this has been said by World Health Organization Director General that auricular therapy is probably the most developed and best documented scientifically. You might be practicing any other therapies, but no problem. But document every other therapy, every other thing that you are practicing, so that it will be useful for the next generation to come. So this is the inverted fetus that Dr. Paul Neuger was referring to. See, it is a fetus on the womb that exactly replicates the ear, the structure of the ear. So, based on this, we are going to start the treatment with. This is the reflection of the entire body on the ear. So wherever if there is a problem in the head, we will be giving treatment in this particular area. If there is a problem in the abdomen region, we will be giving treatment in this particular area. On the extremities, we will give treatment on this area. So we will study all these things in detail, but this is an introduction class, and this is what Paul Neuger has been referring to. So hope you understood this class very clearly. We will meet up in the next class. Thank you. Bye.